So we know there's approximately 30% of patients that do not achieve MRD negativity on treatment. And this includes treatments such as DKRd, which is now standard of care and widely adopted worldwide. And so in order to understand what are the determinants of response, we had a look at what happened in the microenvironment, both at diagnosis and after 8 cycles of treatment. And what we saw that there were changes in the microenvironment that were both function of time and response. And at diagnosis, patients that achieved MRD negativity had evidence of NK cells and higher proportions that produced interferon gamma, a monocyte pattern with activating type 1 response and IL-27 response. And also, when we analysed the TCRs of these patients, we saw that they had a highly diverse TCR repertoire. And what happened at the second time point, when most of the disease disappeared, we saw that the T cell diversity disappeared, and you had very oligoclonal T cells. We saw that these NK cells producing interferon completely vanished, and the pattern that we saw on the monocyte was more of a resting regulatory pattern. And this was the complete opposite of what we saw in patients that did not achieve MRD negativity, where there was none of these interferon producing NK cells. At diagnosis, the monocytes were resting and the T cells were not very diverse. But after treatment, after 8 cycles, we saw a change in the phenotype of these NK cells that persist in the microenvironment, with persistent T cells with a rather diverse repertoire, and monocytes that were trying to express some evidence of interferon type 1 response. And so all that information I think could be used in the future to try and pinpoint what can be actionable and what could be done in these patients to improve their depth of response by manipulating the microenvironment.